Hello, my name is Nicola Donelan, and it's my pleasure to be here at ESDR meeting in Salzburg. Today I'm presenting on behalf of Dr. Stockflat and Dr. Duma, who could not be here today. The title of my poster is Sonidegib Safety and Tolerability Across 30 Months. Results from the randomized phase 2 BOLD trial. So an introduction on basal cell carcinoma. So basal cell carcinoma is the most common form of skin cancer. Its incidence rates are increasing at about 3 to 10% annually, and there's a lifetime risk of approximately 30% of developing this type of skin cancer. Sonidegib is a drug which actually inhibits the hedgehog signaling pathway, which is a well-known pathway to play a role in the pathogenesis of basal cell carcinoma. And specifically, Sonidegib inhibits the protein SMO. If you look at figure 1, try to highlight it. Oh. Well, anyway, figure 1 shows the mechanism of action of Sonidegib. So now Sonidegib was approved back in 2015 based on preliminary results of this BOLD phase 2 trial. And now I will be presenting a 30-month follow-up, the data from that same BOLD trial. So the methods of how the BOLD trial was done. So BOLD study is a multi-center, multinational, randomized, double-blinded phase 2 study with looking at 2 doses of Sonidegib, 200 milligram and 800 milligram. So you can see in figure 2 the study design. So the patients that are enrolled have locally advanced basal cell carcinoma and metastatic basal cell carcinoma. These are 2 types of basal cell carcinoma that are notoriously difficult to treat. And the endpoints that, that we look at in this BOLD study, if you look at figure 3, the primary endpoint is to determine the objective response rate. And this is defined as the proportion of patients with complete or partial tumor response. Then key secondary study endpoint looks at the duration of response and complete response rates. Then some other secondary study endpoints include safety and overall survival. So let's look at the results. So a total of 230 patients were enrolled. And if we look at table 1, you can see the patients' demographics for the study. And it was very well balanced between the 2 groups. So between 200 milligram dose and 800 milligram dose, we had similar age, similar male to female ratio. One thing to note was that at baseline, there were greater than 50% of patients in the locally advanced basal cell carcinoma group had an aggressive histological subtype. So then now we look at the results from the efficacy primary endpoint. So if you look at table, this is tables 2 and 3 shows the results from the efficacy data. And table 2 shows only the locally advanced basal cell carcinoma patients, while table 3 shows the results for the metastatic basal cell carcinoma. And if you have a combined result, so if you combine both LA-BCC and MBCC, and the combined objective response rate for the 200 milligram group was 48%, and for the 800 milligram group, 41%. Now, if we look at the safety and tolerability results, these are shown in figure 4 and figure 5. So figure 4 shows the 12-month safety and tolerability data, and figure 5 shows that data for 30 months. What you should take back with you is that there was actually no new adverse events that popped up, with 30 months treatment. And the profile, so the safety and tolerability profile remained pretty consistent. So most of the adverse events were within grade 1 and grade 2. So that's the blue and the green bars. And there were a few more severe adverse events, but really a very much smaller percent. So 2 to 3% were of grade 4. So then, to conclude, at the 30-month follow-up, Sonidegib at a 200 milligram dose demonstrated and continued to demonstrate efficacy and durable tumor response in patients with locally advanced basal cell carcinoma and metastatic basal cell carcinoma. And it maintained a consistent and acceptable safety and tolerability profile with no new emerging adverse events or safety concerns. Thank you for your attention.